Hi, my name is Nicole and I'm 44 years old. Prior to my PRP injections, I was diagnosed in my mid-30s with degenerative disc disease, which meant the neck and back pain I was occasionally having wasn't going to go away. It was only going to get worse. And it did. It became constant, intense, added some migraine, added some vertigo, and topped it off with nausea. That became my daily life, just trying to survive the pain I was dealing with. No longer interacting like I did, wasn't as active as I was. I was basically trying to go to work, trying to teach, getting back home, and trying to fall asleep to avoid the pain. My primary care physician went back to him and said, "What can I do?" Well, yeah, pain management clinic, or you could recommend surgery. Well, I didn't like those options. There's got to be something else out there. I was hopeless. I was desperate. What could I do? So my husband, prior to this, had some stem cell injections and was able to avoid a total knee replacement. He suggested I call and get at least a consult, see what Dr. Tambar could do. So I did. And from the first phone call with the receptionist to talking with the physician assistant and even doctor himself, I was very impressed. They were friendly, they were respectful, they were thorough. Any question I threw at them, they had an answer. It wasn't, well, we need to get back to you, or we'll discuss that and on another appointment. They had the answers. They were upfront with me because I said, I really don't think I'm a candidate. I got low iron. Well, we'll do some blood tests. We'll see. It might mean that you have to do more than one round. You have both neck and back areas that need to be treated and have to be done separately. So that was, the first thing that they were upfront about. I was like, you really can't just do it all at once? No. And then I found out not only are they going to stick needles in my joints in my spine, but also in the ligaments and the muscles, and you're not out. There's no anesthesia. I was like, what? No, really? Like, you can't knock me out? Like, can't I opt for that? But I was like, all right, we'll do this. So first round, I went through. Didn't think I was going to do it, but I did it. And doctor talks to you the whole time. He's thorough. He's keeping you engaged, letting you know what's going on. Was not as intense as I thought it was going to be. And took the full 10 to 14 days that he recommended I take off. Did the 20 physical therapy treatments. And, I was like, wow, I feel like 100% better than I was. Like, this is great. Like, when can we do the next one? When can we get the other area? So did the next one. Now, I did do a total so far of 2 rounds on my neck and 3 rounds in my back, and I feel fabulous. Every time I didn't think I could get any better, and I got better. The only thing I regret is I waited so long between the first time, the first round of the neck back injections before the second round, because I just kind of figured, well, it's better than what it was, so that's as good as it's going to get. But it wasn't. It got even better. And, working with Dr. Tambar, he's, like I said, thorough. He's great. His whole staff is. I do recommend you keep up with physical therapy because that's what really helps. And this last round, I had it. Within a month, I was hiking 9 miles a day when we would go on our treks and with the family. And I only did like 3 rounds of physical therapy because I kind of know this routine now, and I only took like 5 days off of work. And if you are anywhat on the bubble of contacting Dr. Tambar or his office, just do it. Go for the consult. Get your questions answered. Take your list with you. I know I did. He's a great guy, great doctor, great staff.